A local doctor takes you step by step through new COVID-19 testing procedures. Phil Lindemann, Krystal, 93 News. First, Mother Nature was exceedingly unexceptional last month, according to National Weather Service, with no broken records and snowfall totals far below average. Breck and Copper each got 20 inches in 31 days, less than Nederland got in a single day, March 19th, with 22 inches. Even the metro area saw up to 10 inches that day, more snow than any single day in Summit last month. Local snowpack is still riding high off a record February at 109% of average today, 116% at Hoosier Pass, 111 at Fremont Pass. Vail Mountain is 95%. Centura Health yesterday closed a large emergency urgent care center in Avon through May 1st at least, forcing some of Eagle County's virus patients to get help in Summit. This from the Vail Daily. Centura officials say the Avon Center is closing to centralize operations in the high country, not due to dwindling resources. This comes as caseload in the Vail area hits 349 confirmed cases, 10 times higher than Summit, although Governor Jared Polis says all virus data is still a week or more behind real time.
Another lagging indicator, a ghost that we're going to be chasing and reporting on, will be the number of hospitalizations. So that will lag several days behind this.
At Summit Community Care Clinic, there are no lines out the door or staffing shortages, and new protocols mean more sick locals are getting tested before they are critically ill. Chief Medical Officer Dr. Casey Cowie.
So far, we've tested 25 patients. We've had 6 positive tests, 12 negative tests, and we still have 7 pending.
Those numbers are for the care clinic only. So what's the most common question these days?
The biggest question is, do I need a test? And nowadays, that's a really hard question to answer because it keeps changing.
Here's how testing works. First, sick patients get a virtual screening, or this if they come to the clinic.
If we have patients that call in that have symptoms that are potentially consistent with COVID-19, they're triaged by one of our nursing staff.
Patients with mild symptoms, like fever under 100.4, are told to self-isolate. Those with more severe symptoms, like high fever or chest pain and coughing, meet a doctor.
We're scheduling them for a visit with a medical provider in an outdoor space that we have behind the medical office building. And there we're able to assess the patient face-to-face, lay hands on the patient, listen to heart, lungs.
Patients in critical condition are moved to the front range, but Denver hospitals could run out of space between now and July, and everyone statewide is low on testing kits.
We're not doing as much testing as other places in the state, which causes our numbers to be artificially skewed, showing less positive cases than we know that are out there.
Krystal listeners and others are wondering if novel coronavirus was here long before Colorado's first confirmed case on March 5th, maybe far back as January or even December. Dr. Cowie.
It's really hard to say. There wasn't enough of that clustered in our own clinic to be able to make any kind of determination at this time.
According to state reporting, February 14th was the earliest date for COVID-like symptoms in Colorado, tied to one case confirmed in mid-March. The latest now on COVID-19 across Colorado as confirmed cases rise by 250 to 380 daily since last Wednesday. They're streaming Krystal 93 in Denver County today, home to 586 positive cases, the most in Colorado, representing about 1 in 6 cases statewide. Denver is third for coronavirus fatalities, about 1 in 10. Summit County confirms 40 cases as of today, 6 more than yesterday, with no fatalities. Statewide, there are 3,342 cases today, with 11 new deaths reported yesterday, bringing the state total to 80 fatalities. And now a headline from the COVID-19 Twilight Zone, where in Los Angeles, a train conductor allegedly derailed a train at LA Harbor, hoping it would crash into a U.S. Navy hospital ship docked there. ABC News reports the 44-year-old conductor told the FBI he wanted to wake people up, convinced the hospital ship is the first sign of a government takeover. No one was injured, and the train stopped 250 yards short of the ship. Avalanche danger is moderate above treeline and low at all other elevations in Summit Eagle County zone today, with changing conditions as snow maybe arrives. Your problems are persistent slab and wind slab, both above treeline on north through southeast aspects. And in local sports, brought to you by Wilderness Sports in Dillon, trails and trailheads across Dillon Ranger District are still open and will most likely stay open through the weekend. Backcountry travel is still not banned by public health orders. Phil Lindemann, Krystal, 93 News.